So the challenges regarding the treatment of lupus nephritis includes challenges that are posed by the patient, challenges regarding the therapy efficacy, and also the side effect of the therapy. So talking first about the patient factor. So we have to remember that lupus nephritis patients are typically young patients that did not grow into their illness. This illness did hit them suddenly. And this is an important factor. So they're not used to take so many medication, and suddenly over like a space of 1 to 2 months, you are asking them to be on like 10 or 15 pills a day. And this pill burden is very big issue for them. In addition, we know that the treatment of lupus nephritis does take some time. So initially over the first few months, these patients are exposed to a lot of pills, several infusions, repetitive blood work, and they're not seeing the response or an improvement. And this will lead to a problem with compliance. And compliance is a big factor that lead to a lot of losses of kidney loss and life losses when it comes to lupus nephritis. There is other patient factor related to the ethnicity and the fact that it's disproportionately affecting patients who are from racial minorities and also tend to be economically and socioeconomically disadvantages. As far as challenges related to the treatment, there are challenges related to the efficacy of the treatment. So even the newer approved medication, the efficacy rate is in the range of 30 to 40% as far as complete remission, and partial remission is 30 to 40%, and we have a good 20 to 30% who are not responders. So even with the newer approval of the newer medication and with the newer therapy that we have in place, we still are lacking behind as far as efficacy rate. And the side effect profile of all the treatment that we give are quite high, starting with corticosteroid, which is a common medication that's prescribed in lupus nephritis, and it does cause a lot of side effects. The most important side effect, at least from the patient perspective, are the cosmetic side effects, skin changes, hair losses, and weight gain, and the psychiatric side effect as far as insomnia, irritability. So the patient will complain a lot of these side effects, especially after a few weeks of high-dose steroid therapy. The other medication that we frequently give for lupus nephritis, like mycophenolate mofetil, does cause a lot of GI intolerance, increase the risk of infection, and it is a teratogenic drugs, and most of our patients are usually female at the childbearing age. Going to the other treatment, for example, cyclophosphamide, that is frequently prescribed in lupus nephritis, it does increase the risk of infection. It does have other side effects related to decrease, it does affect the ovarian cycle, and it does decrease the potential or the chance of these young patients to get pregnant in the future, in addition to having a risk of increased cancer down the line. So recently, two new medications, voclosporin and belimumab, were approved for lupus nephritis. Actually, these two medications are the first medication FDA approved for lupus nephritis. The results from the studies on these two medications were quite promising, but there is still a lot of question mark regarding efficacy and the subgroup of patients that will benefit the most from these therapy. So starting with voclosporin, the result of the trial were quite positive, where we had an efficacy or complete remission in the range of 40%. But the study was a short-term study relatively for lupus nephritis, and we're still waiting on the long-term outcome of these patients. We did utilize proteinuria as outcome, but we would like down the line to evaluate the effect of voclosporin on eGFR decline and end-stage renal disease incidence for these patients. And we would like to see if voclosporin efficacy that was shown initially will translate to a long-term efficacy. The encouraging part with the voclosporin therapy is that the investigator did utilize a very ambitious approach to steroid taper, and their approach turned out to be very efficacious. So there is a lot of plus in the clinical trial that was presented, and we're waiting for additional data to see if this initial improvement or initial positive signal will translate into a long-term better outcome for our patients with lupus nephritis. When it comes to belimumab efficacy, the efficacy of the trial was a little bit lower than the voclosporin, but they were not compared head-to-head, so it's difficult to compare the belimumab efficacy compared to voclosporin. But belimumab did add to the standard of care that we have right now as far as improved efficacy and early efficacy early on, where the efficacy will start or the curve start to divert early on around 8 weeks. Also, these patients did require lower amount of corticosteroid, but there is a lot of question mark about which subgroup will benefit the most from belimumab. We did notice in the subgroup analysis, the patient that received cyclophosphamide, adding belimumab did not add much to the clinical outcome. In addition, patients who have high level of proteinuria might not benefit a lot from belimumab therapy. So overall, if I want to summarize the result of these two trials in voclosporin and belimumab, I would say that they are encouraging, but there is a lot of work to do into identifying the subgroup that will benefit the most from each of these therapy. And also there is some question mark about the long-term efficacy of this therapy that will not be answered until we have additional data. So regarding precision medicine in the treatment of lupus nephritis and lupus nephritis in general, I think this is a field that we are a little bit lacking behind. We do know that not all lupus patients do act the same as far as response to treatment or even the long-term prognosis. And we do know that there is a difference that are related in ethnicity and genetic background for these patients. So overall, we know that we should be moving into a precision medicine type approach for lupus nephritis, but at this point, there is nothing clinically that is currently being used where we can tailor the treatment depending on some specific biomarker that could be specific for the patient.